So we're here to encourage our lawmakers to ensure that kids have access to the right health care at the right place at the right time. And we're very, very lucky to have on the peninsula a true champion of children as our representative in Congress. She fights for children every day, and having been to Washington many times, I can assure you that really is true. That's her reputation, among many other really great attributes. She recognizes that children's health care needs are best met by pediatric trained physicians, nurses, and therapists. She has fought to ensure that medications used by children receive the appropriate testing. She has fought to provide funding for programs like the Children's Hospital Graduate Medical Education Program that, as we all know, trains generations of pediatricians and pediatric specialists. She has fought attempts to cut programs like Medicaid and the state children's health insurance program. We have with us one of the long-standing warriors of children's health. Ladies and gentlemen, Anna Eshoo.
Thank you, Chris. Thank you, Chris. That's quite an introduction. I always say I wish when I'm being introduced that my kids were here. But you are, and that's what's so important. Chris, thank you for your extraordinary leadership of Lucile Packard Children's Hospital, to Dr. Lisa Chamberlain for what you do, to everyone that's here, certainly Sherry Sager, who is, she prowls the halls of Congress on behalf of everyone here and what you stand for and what you believe in, and I salute her for that. Obviously, to all of the residents, and these are fabulous signs. Someone needs, right, raise them up. Someone needs to give me one of these signs. I'm going to put it on the door of my office in Washington, D.C., so that every single member of Congress, that walks down that corridor in the Cannon Building sees it and reads it and takes it to heart. You know, a year ago, I got to cast a vote that I will always be proud of. There's a struggle for almost 100 years in our country to provide health care for all Americans. And in that legislation was the promise for children that every child in our country would receive the kind of health care that they are worthy of. Why is this so important? We know how obvious it is, but it's a value of our society. It says everything about us, about who we are and what we are. And today, during this National Day of Action, with you, the pediatric residents here at Lucile Packard Children's Hospital, and across the country, your colleagues are standing up for kids as well. And we must. Now, what's going on with this? Why wouldn't everyone embrace and say, of course, the graduate medical education for pediatricians at children's hospitals across the country be a top priority? I think the best way to capture it is that we have more people in Washington today that know the price of everything but value very little. They simply don't know. And so what this National Day of Action is designed to do is to prick their consciences and to say that you are here in order to take care of our nation's children. Lucile Packard takes care of the children, saves their lives, makes investments in them, teaches parents all the good things that they need to learn and to know. Why? Because we're shaping future citizens for our country. And so I'm so proud. I am so proud. I just can't tell you how proud I am. When people ask me what congressional district I represent, I say it's the home of Stanford. It's the home of the Stanford Medical Center, and it's the home of Lucile Packard Children's Hospital. So I stand with you. And, you know, the president was here. President Obama was here, as you know, a week ago today at Facebook. And when I was there, and he said Nothing is easier than solving a problem on the backs of people who are poor or people who are powerless and don't have lobbyists or don't have clout. Well, I agree. So, President Obama, we're going to hold you to your words. We're going to hold every single member of Congress. This is not a partisan issue. This is something that unites all Americans. How proud I am to work with you, to represent you, and even prouder today that you would take the time to cross the street with all of your signs and stand for kids as you do every day and make this National Day of Action a reality. God bless all of you for healing, for touching, for caring. I'm with you, and as long as I'm in the Congress, I will be. Thank you very, very, very much.
Thank you very much, Congresswoman. Anna, we have something for you. We can't give you gifts, but we have something that I think is better than a gift for you. So I think Dr. Khalil has something for you. He's actually wearing it.
Look at that. Isn't that great?
So first of all, we'd like to thank you for being here and supporting our cause. This was a project put together by all of our residents, signed by residents, faculty, fellows, nurses, and therapists all across the hospital here and at the Valley down in San Jose. So we'd like to give you one more gift to take to your office in Washington, hang it up on the door, wear it to the house.
That's great. You're going to give this to me?
I'm going to give this to you.
Isn't this great? You know what I'm going to do? You know what I'm going to do? I'm going to wear this. But not only today. I'm going to make a commitment to you that I'm going to go to the floor of the House with this on and tell not only the Congress but the people of America what I have on and what it represents and what a gift you all are to the nation, and that we're going to protect this program so that we have pediatricians, pediatric specialists, and everything that goes with it to take care of the angels of our country. Thank you very, very much. This is great. Thank you. Thank you. Oh, this is fabulous. This is fabulous. Ooh, I love it.